Hello, welcome back. I am Dr. Asma from Yale Academy. Today, we will continue our revision course for FPGE, NAPLEX, Canadian and Australian Pharmacy Board exams. Are you ready? Let's start. The start will be a question asking for which drug of choice for intensive lowering of LDL. Look at this picture and let's find the most drug of choice for each lipoprotein. For intensive lowering of LDL are statins drugs. For get highest level of HDL, niacin drug. But, best is lifestyle modifying, with exercise. For intensive decrease in triglycerides, fibrates are recommended. Now, next question, which is about when to start streptococcus infection treatment during pregnancy. As a fact, any pregnant woman who had a baby with group B streptococcus disease in the past, or who has had a bladder, urinary tract infection during this pregnancy caused by group B streptococcus, should receive antibiotics during labor. Most early onset group B streptococcus disease in newborns can be prevented by giving pregnant women antibiotics through the vein during labor. Now, next question asking about mechanism of aspirin is A. Sulfonation of COX, B. Methylation of COX, C. Acetylation of COX, D. Polymerization of COX. Do you know the answer? I think you got it now. Yes, correct. It is acetylation of COX. The question now is true or false. Are you ready? Great toddler syndrome with the use of the antibiotic chloramphenicol is due to immature liver? Answer is true. Immature liver for neonates still 3 years old result in impaired glucuronidation metabolism, which is main route for chloramphenicol metabolism. Next question also, true or false? Pharmacists should only refer 3-month-old baby with febrile seizure to pediatric. Answer is false. Pharmacists should provide education on the use of antipyretics for comfort, discuss appropriate age-specific dosing, and advise that antipyretics have not been shown to decrease the incidence of seizure recurrence. It is also helpful to advise parents and caregivers about what to do during a seizure. The child should be placed on a protected surface on his or her side, and nothing should be placed in the child's mouth. If the seizure lasts longer than 10 minutes, emergency medical services should be contacted. Also, parents and caregivers should be informed that any child experiencing a febrile seizure should be evaluated by a medical professional to determine the cause. Next question is about ginkgo biloba is used mainly for what? Okay, correct answer is mental health. Next question is unexpected one, but it is from Real Pharmacy Board Exam FPGE, E 2017. Before I ask the questions, I will let you watch with me about microRNA function. A 55-year-old woman is diagnosed as having breast cancer. Further analysis reveals that levels of the epidermal growth factor 1, HER1, are elevated at the protein and mRNA level. Further analysis reveals that the rate of transcription is unaltered. However, the mRNA stability is increased. A microRNA is discovered, whose expression is decreased in this patient's cancerous cells. In this context, what is the likely function of this microRNA? A. It inhibits transcription of the mRNA. B. It inhibits translation of the mRNA. C. It promotes degradation of the mRNA. D. It promotes enhanced splicing. E. It promotes mRNA export from the nucleus. So answer will be choice C, which is degradation of mRNA. Last question of today revision lecture. With the ICD-10 patient coding system, the length of inpatient procedure codes will increase to A. 7 alphanumeric characters, B. 3 alphanumeric characters, circa 13 alphanumeric characters, D. 10 alphanumeric characters. To be able to answer that question, let's talk about decoding healthcare codes. Old one was ICD-9, which is 5 numbers that identify and categorizing patients according to disease condition in healthcare system. Nowadays, the most up-to-date is ICD-10, which is more specific for classification of patients according to their disease condition. And it composed of 7 alphanumerical characters, not 5 numbers as ICD-9. Finally, it is the end of today's revision lecture.